Hi everyone, welcome back to my channel. This is Dr. Zina speaking. Today we will be speaking about what is the difference between fenestration and dehiscence. But before we continue, make sure to hit the subscribe button down below for more and more videos. Now, what is fenestration? There is a simple mnemonic I wrote. You know that the word fenestration starts with an F, so it is foramen-like. Okay, so there will be a foramen, and you can see that the marginal bone will remain intact with fenestration, not like the opposite way around in the dehiscence, which is equal to down. It's going down. So in dehiscence, as you can see in the picture, that the marginal bone is not intact, and it starts with the letter D, so it is denuded areas are extended. Okay, so more extension of the denuded areas, and therefore the marginal bone is not intact in this case. So that is the dehiscence. So this is how you can differentiate between fenestration and dehiscence. Fenestration, you will see foramen-like. So there will be a foramen, a hole, and the marginal bone there will remain intact. Whereas the dehiscence, the denuded areas will be extended. So there will be not a hole, it will be extended so that the marginal bone is not intact in this case. What the patient will complain of, commonly, of course, hypersensitivity to the normal thing. Another picture to explain for you the difference between fenestration and dehiscence. You can see in fenestration there is a hole and the marginal bone is still intact, whereas in dehiscence you can see that the marginal bone is not intact and the denuded areas, so it's going down. So the denuded areas basically are extended in dehiscence, D and F. Now I'm going to ask you what this picture represents. Is it fenestration or dehiscence? Make sure to pause the video so that you can answer, and in order to find the correct answer, I will tell you now. So you can see that the marginal bone is still intact and there is a foramen, there is a hole. It's not extended, not like in dehiscence that is extended basically, and you can see the whole root of the tooth can be seen. But here, because there is the tooth, the root of the tooth is still covered by bone. So therefore, this is fenestration. So the answer here is fenestration, which is foramen-like, and the marginal bone is still intact. Another picture, as you can see, the picture on the right side, there is a hole. The bone is still intact, so this is fenestration. The picture on the left side, the tooth on the left side is dehiscence. So dehiscence on the left, fenestration is on the right side. Here's a clinical picture for one of the patients. He had, what is the answer? That's correct, he had fenestration. So this, why fenestration? Because still the marginal bone is still intact. So therefore this is referred to as fenestration, which is a foramen-like. Now, I think you all are asking or wondering, what are the causes behind fenestration and dehiscence? The cause, number one cause, is age-related changes due to thin alveolar bone. You know that when we age, we will end up having a thin alveolar bone. So we might have, at the end, the root of the tooth will be exposed. So we might have fenestration and dehiscence. Another cause, less likely to happen, is crowding of the teeth. When we have crowding of the teeth, we might also see such cases where they will be having fenestration or dehiscence at the end. Now, what is the treatment in this case? You can easily guess the treatment. The root of the tooth is exposed, so we need to cover up the root of the tooth, either by GTR, which is guided tissue regeneration, in which you place a membrane in order to cover up the exposed root, or either flap surgery. We need to raise a flap so that we close the exposed root, or free gingival grafting, we can just simply do a graft in order to close the exposed root. So these are simple, permanent treatments for both fenestration and dehiscence as well. Thank you all for watching my video. If you have any questions or if you are in doubt of anything, please do ask me in the comment section below. And thank you so much. Goodbye.